Good morning to all those who make this broadcast possible, to Abdiel, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 6,408 people are hospitalized in Cuba. 4,738 are under observation. There are 1,154 suspected cases and 516 confirmed active cases. Yesterday, we processed over 7,000 samples in our molecular biology laboratories, 7,545 to be exact. 2,285 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 985 in Havana's Hygiene, Epidemiology and Microbiology Center, 945 in Villa Claras, 376 in Santiago de Cubas, 418 in the Hermanos Almajeras Hospital Laboratory, 402 in the Molecular Immunology Center, 376 in the Genetic Engineering and Biotechnology Center Lab, 307 in the Manuel Fajardo Hospital, 317 in the Fructuoso Rodriguez Hospital, 315 in the Naval Hospital, 284 in the Civil Defense Laboratories, 273 in the ICA laboratories, and 199 in the National Center for Genetics. Of the 7,545 samples processed, 48 tested positive for COVID-19. That's 48 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 628,725, of which 5,718, or 0.91% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. 76 from Pinar del Rio, the most from Havana with 4,226, Mayabeque 268, Matanzas 610, Cienfuegos 107, Villa Clara 79, Sancti Spiritus 317, Ciego de Avila 1080, Camagüey 345, Holguín 194, Santiago de Cuba 92, and so on and so forth from all of the country's territories. Of the 48 positive cases diagnosed yesterday, 43 are Cubans and 5 are foreign residents in the country, and the result of local transmission. These cases are therefore not imported, although they correspond to 5 foreigners. 44 or 91.6% of the 48 positive cases yesterday are confirmed case contacts. All 44 individuals were already in isolation centers at the time of testing and diagnosis. This means that 91.4% of all cases on the island since the pandemic began have had contact with someone who previously tested positive for the virus. The source of infection linked to 4 cases yesterday is yet to be determined. Meanwhile, the source of infection in 48 cases reported over the last 15 days is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 443. Of the 48 diagnosed cases yesterday, 32 are male, for 51.3% of all cases, and 16 are female, representing 48.7% of all diagnosed cases on the island. 38 or 79.1% of the 48 cases yesterday were asymptomatic at the time of testing. Overall, 60.9% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 79.9% of cases diagnosed over the last 15 days. By age group, 10 positive cases diagnosed yesterday are under the age of 20. In fact, all of these cases are under 18 years of age, for a total of 625 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 528 or 84.5% have recovered from the virus and been discharged from hospital. Meanwhile, 19 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 13 cases are between 40 and 59, and 6 are over the age of 60. Of the 48 cases diagnosed yesterday, 27 belong to Ciego de Ávila, 13 to Havana, 6 to Sancti Spiritus, 1 to Matanzas, and 1 case to Artemisa. The case from Artemisa belongs to the municipality of San Cristobal. The 13 cases diagnosed in Havana belong to the municipalities of Regla, with 5, Boyeros, 3, Habana del Este, 2, Playa, 2, and Plaza de la Revolución, with 1 case. The case from Matanzas belongs to the municipality of Cárdenas. The 6 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus, with 5, and 1 case to Trinidad. Meanwhile, the 27 cases from Ciego de Ávila all belong to the municipality of the same name. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 61.09. Havana follows with a rate of 16.30, then Sancti Spiritus with 13.09, Matanzas has a rate of 10.28, Mayabeque 2.60, Artemisa 2.14, Camagüey 0.39, and Holguín with 0.20. Cuba's rate therefore stands at 6.93 per 100,000 inhabitants over the last 15 days. Meanwhile, Cienfuegos, Pinar del Río, Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases over the last 15 days. Some of these provinces have reported no new cases for several weeks, and others none over the last few months. To summarize, of the 5,718 people who have been diagnosed with the virus thus far in Cuba, 516, or 9%, are active hospitalized cases. Of these, 510, or 98.8%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island remains at 122, with a mortality rate of 2.13%, lower than the global rate of 2.98% and the regional rate of 3.33%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 156 people were discharged from hospital. This is a positive result when compared with the number of confirmed cases diagnosed yesterday. 3 people were discharged from hospital in Artemisa yesterday, 99 in Havana, 27 in Matanzas, 2 in Sancti Spiritus, 21 in Ciego de Ávila, 3 in Camagüey, and 1 person in Granma. This means that, to date, 5,078 people, or 89% of all confirmed cases in Cuba, have recovered from the virus. Today, 1 patient continues to be in a critical state in hospital in Matanzas, while 5 are reported as serious and being treated in hospitals in Havana, Camagüey, and Villa Clara. Yesterday, 1 patient passed from critical to serious, and 3 serious patients passed to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 315,335 people were diagnosed with the virus, for a total of 34,029,996 confirmed cases since the start of the pandemic. Yesterday, 6,111 people died of the virus worldwide, for a total of 1,015,043 COVID-19 fatalities and a global mortality rate of 2.98%. The region of the Americas, which accounts for 49.35% of all cases worldwide, reported 115,241 new cases yesterday, for a total of 16,794,263 people to have been diagnosed with the virus. Meanwhile, 3,322 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 560,388 and a mortality rate of 3.33%. The United States continues to top the list of countries worst affected by the pandemic, with over 7 million cases and more than 200,000 COVID-19 fatalities. Next comes India with over 6 million cases. Brazil has 4,816,935 confirmed cases. And then Russia with 1,176,286 cases of COVID-19. These are the countries with the highest number of cases worldwide. Cuba places 117th on this list. From the Americas, after the United States and Brazil, comes Colombia with 829,696 cases. Then Peru with more than 806,000, Argentina, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, the Dominican Republic, Guatemala, and Honduras. These are the countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. This is the information we have on the behavior of the pandemic in Cuba and the world.